next month is National Heart Awareness Month, Heart Disease Awareness Month, so I thought I'd give a little information on that. One of the things, and I'll have some handouts here if anybody's interested in this, that I found not too long ago. I was reading some stuff, and the Framingham study, which started all the heart disease stuff back in the 40s there, when they followed the people, I think it's Framingham, Connecticut, or New Hampshire, one of the towns out there, and they observed all the townspeople, and they've developed a lot of their thinking on heart disease approaches since then. But one of the things they've got on there, I've got the website on there you can go to if you're interested, and then there's a little calculation there that you can figure out your BMI, and you can get on there, and they've got a simple thing you can do to kind of gauge and see what the age of your heart is compared to your chronological age. So those of you who are, say, 40 years old and you got an 80-year-old heart, get things in order. If you got a 20-year-old heart, you're in good shape. And that's a simple way to get on there and just kind of get a general idea of where you're at there. But the other thing I was going to talk about is had some other information I've kind of been collecting for a while. In the field of cardiology, they're starting to take a little different approach to the idea of what's causing your heart attacks and all the heart issues that we have in this country, because the whole basis of all this started about 60 years ago when noted researcher Dr. Ansel Keys came up with the information that cholesterol was clogging all our arteries, and that's what the problem was, so we got to correct that. Well, there's been a lot of stuff that's come out in the last couple of years that even in the popular press that has kind of ripped the guy because he's basically lied, he cherry-picked his stuff, and he fed us a line of bull back then. And so back in those days, one of the things they wanted to do was we had to quit eating fat and start eating more carbohydrates, because carbohydrates have fewer calories, and that would help save us. Well, not only has that sent our heart disease rates up into the stratosphere, but it's also developed the obesity and the diabetes, and probably has had an effect on the cancer situation too, that's all going through the roof. So one of the things they started with there is looking for an approach medically, as far as pharmaceutically developing medicines to lower your cholesterol, and then developing other procedures such as bypass, and then they came up with stents and angioplasty, which they go in there and rotor-root your arteries out, and doing that to help alleviate that. And it's been such a rousing success, we've dropped the incidence of deaths from heart disease in 60 years 1.8%. And the interesting thing is that, especially from the line of the statin drugs, they keep wanting to improve that and get better results, so they keep lowering the levels that you can have your cholesterol levels at. Because years ago when it started, 250 was normal, then it was 220, then it was 200, it's 180 now. And, you know, I've seen some things where they're wanting to drop even further. And I always use the example, I had a couple of men, this probably been 10 years ago, patients of mine that both had normal cholesterol reads. In fact, it was great. They were 140, and this is back when 220 was normal. And they both had quadruple bypass surgery. And after they'd recovered, next time they came in, I was asking them and talking to them about it. And I said, did you ever think to ask your doctor about that? I said, you know, normal's 220, you're 140, you're not taking any medicine at all. And how'd your arteries get plugged up? He said, no, I never thought about that. So I said, well, next time you go in and ask him about that, I'd be interested in that one. But after the fact, they were all put on numerous medications for that to help, you know, alleviate the problem. But usually everybody I've seen, once they've had a heart attack, stroke, or bypass, are always, even if their cholesterol is perfect and their ratios are perfect, they're all put on statin drugs, and they all want to get them down around 100. And I tell them, get a new doctor because you're going to die. But one of the things I like to ask patients, I give them information on it too, but I said, how long can you live if your body makes no cholesterol? Because your liver makes 70 to 80% of your cholesterol. And to me, that sounds like it's more of an essential nutrient rather than something to be feared. But if you could turn a switch on your liver, make no cholesterol and take no cholesterol in, how long can you live? People come up with a variety of answers, and I always tell them, I said, about 4 to 5 days. You can live longer without water than you can without cholesterol, because the #1 ingredient necessary for all of us, male or female, to make hormones is cholesterol. No cholesterol, no hormones, you're dead. It makes up a portion of your brain, so as your cholesterol cells die off and new ones need to be replaced, if you can't replace them, long-term use, and this is one of the side effects of that, they've seen in long-term use with statins, that you can develop Alzheimer's-like symptoms. You can also develop Parkinsonian-type tremors because your covering of your nerves, all the nerves in your body, made up of, is primarily made up of cholesterol. Can't replace that, then you can't communicate from brain to tissue cell, and then you start having tremors with that. So I'm sure there's some people diagnosed with those two diseases that don't have it, they probably are just low on cholesterol. So that's something to be aware of on that. But one of the things they, got another article here, and I'll leave some of these up here if anybody's interested in taking one of those home and looking at it. But again, the conventional treatments now are lowering your statins. The persons, especially if they do have a heart attack or have some major symptoms and they do a heart cath and they see some clogged arteries, they go in and do a bypass, or they'll put stents in and do the angioplasty there. But one of the things they found is that probably in a majority, the vast majority of times, and they even see this on the heart cath, is the body's already created a perfect bypass around that blockage in there, and really better than anything they can do. But because that's the standard of care, when they go in there, they have to replace that, otherwise they'd be in trouble. And I always tell patients, I said, here's what you do, because when I measured scars on people's legs or arms, and they take out 40 or 50 inches of vein to replace about 3 inches of artery. And I said, why do they need so much? Because that vein isn't too good. Because they replace a severely clogged or a closed artery with a clogged vein, basically. And a diameter of an artery is smaller than a vein, or is larger than a vein. So that's why on the average, I think it's increased a little bit, but it used to be on the average, you had about 6 years to your second bypass and 3 years to your third if you were still alive. Because it's more of a stopgap measure to keep you alive. Now there's people who have gone 30 years with bypass, no problems, and I've seen people who had to have a bypass a month later. So just what the average is there. And depending too on how much you change your lifestyle afterwards. But one of the things they even talked about was, numerous doctors like Dr. Dean Ornish, a noted cardiologist out in California who developed the, worked with the Pritikin program for years, and he's had his nutritional program that he does with his patients there, or gives them the option of doing that as far as cleaning up the diet there and doing things. But one of the things they're looking at now, especially even expanding on his realm, was he still allowed the carbohydrates in that, but one of the areas they really focus on now is restricting the simple carbohydrates, have a lot of fruits and vegetables, and then eating better fats, and not making everybody afraid of fats there, because basically your natural fats, many of us in here can remember back in the 50s or 60s or even before that, how you ate and how your parents cooked. You had, probably there was at least one meal a week was fried, and you ate, mothers cooked and baked and everything with lard. I can remember my mother had a huge tin of lard underneath her cabinet, and she never used cooking oil until the late 80s. And that's what they did. And most people were relatively thin back then, and of course our activity levels were much different too. But as time has gone on, we got away from that stuff and went more to the processed oils and different things. And I just noticed last year, I think the FDA came out and required all food manufacturers to take all trans fats out of they can't put anything in anything. substance there. Whereas prior to that, they wanted to reduce it, but they did allow manufacturers to say that I have 0 trans fats in my product, but you could have up to 15% trans fats in there. Now, trans fats, which are man-made fats, do clog your arteries. The other stuff doesn't. Cholesterol doesn't clog your arteries. Saturated fat, you know, now if you overdo it, I'm sure there could be some bad effects, but for the most part, isn't going to create that big of a problem there either. But anything, unfortunately, in any food product, just about anything that man makes, probably don't eat it. And like the old health gurus used to say, if it isn't grown in the ground or above the ground, don't eat it. Or if it comes in a bag, a can, a box, a jar, or out of a window, don't eat it. And I always like that one because most of us live on that at different times when we're in a hurry there. But one of the interesting areas on this, I won't bore you with the other stuff, but one of the things where they're really starting to look at more is the effect of the nervous system on the cardiovascular issues, because they found that in different testing and that they do, and they've done some huge tests there, Mayo Clinic and a lot of other notable places have done this when they test people who've had before heart attacks and after heart attacks, and they don't have the changes that would normally be associated with the clogged arteries and that type of a problem. But what they found when they checked the heart variability, and that's testing where they can measure the electrical components to the heart and everything, they see so many changes prior to and then after there, and they're looking at the changes there because with the nervous system, you got 2 parts. You got your sympathetic or your fight or flight system there, and you got your parasympathetic, which slows things down. That allows our body to function normally and to grow. And that covers primarily the internal organs. Sympathetic does have a role with that, but the parasympathetic is what keeps everything in even keel and keeps us in good shape. But what they found is the effects of stress in our daily lives is what's having a major effect on everybody, because whenever the parasympathetic is functioning properly, and then you throw a stressor in there, you're not going to get into much problem there. But when everybody's system is, the parasympathetic is shut down just because of all the chronic stress that we have, and then you have another input of sympathetic stress or fight or flight, that puts a whammy, especially on the heart, and it really hits that, and then boom, you have a heart attack. And it was curious, I think the paper had it, a week or so ago, and they had a list of the, I forget the exact number, 48 or 50 people that died out east from this snowstorm. Oh, sure. And they had a kind of a list and a breakdown of it, and I was looking through that, and probably a majority of them were shoveling snow. Big fact, you know, you don't know all the history and background of it, but I'm sure with that coming in and all the effects of that, let alone coming out of the holidays and whatever else is going on in somebody's life, their stress levels are to the max. And then you go out there and especially a male, not very good shape, no preparation whatsoever, and he goes out there and starts shoveling tons of snow, then whammy, he's a heart attack waiting to happen. And just kind of glancing through the little breakdown they had of all these people who had the heart attacks, I'd say the vast majority of them you can kind of throw back into this category to where the stress levels did them in there.
So the answer is send the kids or the wife out there to shovel the snow?
Yes. And sit in there and have a cold one while you're watching. Now, they go into a little bit more detail, I know with time here, but it talks about one of the reasons that men tend to have more heart attacks than women. Part of it is the stress issues, and I've seen stuff over the years there, they've talked about, well, like our parents' generation, or a lot of our parents' generation, 9 out of 10 women outlived their husbands. The baby boomers, they're talking about 6 out of 10 women, and then our kids' generation is pretty much be even keel there. And a big part of that is because the stress levels are being dumped on the women there. A lot of our parents there, a lot of the mothers were were stay-at-home moms. They did all the work at home and took care of the kids and raised the family, which was stress enough. But they didn't work outside of the home. Our generation, women are working outside of the home, taking care of the family stuff, and so on. And so there's more stress on them. And then with our kids coming up, hard telling how that generation is going to function, but they figure that it'll pretty much be even keel there as far as 50-50 as men and women having heart attacks there. But one of the things, I'll read this here, they talked about part of the effect is with our society, the way things are, the stresses and everything there that we do. But some of the known ways that you can do to keep your parasympathetic system in good shape is be in contact with nature a lot, be outside, you know, take walks in the park, be in loving relationships, which, you know, with 50% of everybody getting divorced, that's kind of hard. Trust, economic security, which, you know, the way our economy is going is kind of tough, and sex.
Sorry.
Right here in the article, I'm just saying. So, yeah, I think we can do 2 out of 4 out of this maybe, but
Timing's one of those things too that makes it.
yeah. So I just need to throw that in.
Which direction are you going with? There's too much not enough?
Okay, good deal.
Well, no, it's all good. So I thought I'd bring that in ways that, you know, people can help take care of their parasympathetic there. But also, just in closing there, one of the things, I found this article interesting too, because that's one of the things, probably several of the best research studies that have been done in the chiropractic profession over the years, especially in the last 10 or 15 years. There were 3 studies, especially that dealt with blood pressure and cardiovascular issues there, that got unbelievable results. And one of them was done up at Rush Memorial Hospital about 10 years ago. And the cardiologist that was head of the program up there was so enthused about it, he wanted to do a much bigger one there, but, you know, it was up to the profession to raise the money. But it was, you know, I thought, you know, that'll never happen, because the chiropractor was involved with it was an old timer that was in our state association. When he was telling us about it, you know, we were talking to him afterwards. We said, you know, this will never happen. He said, no, this guy really wants to do this again. He just wants a much bigger patient load in there. And we said, you know, and then probably within 5 years, as they were raising the money, came back, and the cardiologist, who's the head of the cardiology department there, got in touch with him and said, you know, we really aren't going to be able to do that for you. And he took him out to lunch. He was talking to him. He said, well, why? And he said, well, one of the major drug companies that does blood pressure and a lot of heart medicines found out about this study, and they got a hold of the hospital administrator and brought them in for a little meeting and said, you know, we hear that you want to do a much bigger study on this. He said, yeah, we're really enthused, and they're raising the money now. He said, well, you know, that $15 million we're going to donate for the new wing on your cardiology department there, that isn't going to happen if you do this study. And the administrator just looked at him, and he goes, okay, we won't do the study then. So, you know, we figured that needed to see the light of day, at least at that hospital. But it was interesting. He said the politics behind that, and the guy was very apologetic about it. But he said, you know, my hands are tied, because it's my head on the pole there if we don't do this. So that's one of the things too that you know, talked about that before, is the stress levels in our society. But that's one of the things we need to keep under control and keep in check, not only just for our cardiovascular health, but for our general health as a whole there. That's why I recommend everybody go to Florida once a year and play golf.
Good idea.